Hey everyone, it's Gary here from Liftpedia, and today I'd like to talk to you about a common knee problem that most of us have. But first, stop what you're doing, stand up, and hey, Tyrone! I want to show you guys a real easy test that you can do right now. Alright, so I want you to put your hand on your kneecap for me. Lift up that leg. Yep, without moving your femur, I want you to swing this part forwards and backwards. What do you hear? And this video is right for you. What's going on, everybody? It's Gary here from Liftpedia, and today I'd like to talk about one very common cause of clicking, grinding and popping in the knees. These are very common signs of poor patella tracking and is often associated with pain over a longer period of time, localized in the posterior surface of the patella. When pain starts becoming an issue, it becomes a syndrome known as patella-femoral pain syndrome, also known as runner's knee. Clicking, grinding and popping noises that you may hear in your knees are usually not a concern, as there's lots of synovial fluid in the knee that gets moved around as you're moving through the range of motion. However, if it's constant clicking or grinding in the same position in the range of movement, it may be as a result of imbalance in your muscles, as the lateral or outside muscles most often overpower the inside muscles. This causes the grinding, clicking and popping noises that you may be familiar with, because the patella moves through a groove in the femur bone that's covered in cartilage to reduce traction. All these factors offset the relationship, also known as force coupling, between the muscles that attach to the knee. Okay, so I'm holding a model of the right leg. This is the femur, the tibia and the fibula. What we're looking at is the medial and lateral condyle surfaces of the femur, as well as the patella where the quad's attached to. If there's too much tightness, specifically on the lateral side, which is the outside, it can cause pulling of the patella to the right side, and then that could cause grinding on that surface, which is not what we want. Instead, we want to fix that imbalance. We want to re-establish a neutral force couple where the patella can move smoothly through that groove. Strengthening. The vastus medialis oblique is the primary muscle that pulls the patella medially, and so to strengthen it, slow end of range knee extension is recommended. As well as half squats, which also encourage the muscle activity of the gluteus medius. A form of self-myofascial release can be performed with a foam roller, which essentially works by using physical force, which is the weight of your body against gravity, to break muscle knots and promote blood flow. Stretching, you can stretch your outer quads. Dosage is performed for 30 seconds on each side, 2 times. By constantly performing these stretches and strengthening exercises daily, you can hopefully look to see some improvement in a week or 2, although it obviously varies between people. What's important to note is that these treatment exercises that you do will not give you results instantly. It didn't take a day or a week for the onset of knee clicking and pain, and so stretching for a day or a week will not yield any long-term results. Thank you all for watching. If you like what you see, stay tuned for more.